Good morning, all. I would like to welcome all of you for diabetic retinopathy webinar. So let's find all about the diabetic retinopathy in this session. We are going to talk about all about the diabetes, how it's going to affect our eyes from our senior consultant, Dr. Parveen Sen. I would like to introduce Dr. Parveen Sen over here. Dr. Parveen Sen is senior consultant, vitreoretinal surgeons at Dr. Agarwal Eye Hospital, based out currently at Chandigarh, Sector 22 branch. She is former senior consultant Vitreoretina department from the Apex Vitreoretina Institute of India, that is Shankar Nethralaya, Chennai. She has worked there from 2000 to 2022. She has over 100 publications, 8 chapters, and she has co-authored 3 textbooks about the vitreoretina. She had made several national and international talks. She is reviewer for national and international conferences. Dr. Parveen Sen has received many awards at national conferences and has been part of many international clinical trials. Her specific areas of clinical interest are complex vitreoretinal surgeries. Diabetic retinopathy is very close to her heart, which we are going to talk about today. Then age-related macular degeneration, retinal imaging, pediatric retinal surgery, electrodiagnosis, hereditary disorders of the retina. She is very actively involved in training the young retinal surgeons. She has been a guide and mentor to several vitreoretinal surgeons who are now serving patients all over the country. So let's start the discussion. Let's start this session from Dr. Parveen Sen. In meanwhile, I would request you if you have any questions, if you have any queries while the session, we'd like to have them on the chat box, please. We'll try to answer as many as questions within the webinar, but if still something is left, then we will answer it at the end of the session. So it's going to be a very crisp session. Let's join our hands to welcome Dr. Parveen Sen, Senior Consultant at Dr. Agarwal Eye Hospitals. Ma'am, over to you.
Thank you, Harpreet, for a very nice introduction. And I welcome you all to this webinar on Saturday morning, and I'm glad you could join us today. We have decided to do this webinar for, there are some reasons for it. One is this is the Diabetic Week all over the world, to lay emphasis on the fact that diabetes is increasingly becoming a global epidemic, and a lot of people are having diabetes. We almost suspect that 1/4 of the population in another 50 years will be having diabetes. So this is a very important problem, and it is important to understand how it can affect your eyes. So this particular agenda in mind, we have kept this knowledge sharing webinar with all of you. And diabetes, when it affects the eyes, sometimes can be a silent killer. So let me take you slowly, one by one, to some alarm signs, some symptoms which can make you aware. So I'll be sharing my slides. I have a small presentation which you can see, and I will go over it very slowly. And anytime that you feel you have any questions, please put them in the chat box, or we could take them at the end of the session. So this is what I said. We are going to discuss how diabetes can affect the retina. So as I said, this is becoming an increasingly important problem because almost 10% of the adult population now has diabetes. And among these 10% of the worldwide population, almost 1/4 will have their retina which is affected. And almost 6 to 10% can lose their vision because of diabetes. So this is an important problem. What we will be discussing today is what is diabetic retinopathy, what are the risk factors, what are the symptoms, how you will get screened, what are the stages, how it gets treated, and how you can prevent it. So as we have said, diabetes affecting the retina. A lot of you may ask now, what is retina? We know what is the eye. We know in this diagram that this is the section of the eye and this is the lens in front which undergoes cataract and which becomes hazy and we remove it. But actually, we don't see through this lens. We see through this thin film which is behind it, It is almost like the film of the camera, which the traditional old cameras we used to have. There used to be lens and then a film behind. Retina is nothing but like that film, so that the image is formed onto this film. So however nice your camera, your lenses are, or your glasses are, if your film is not good, you will not have any vision at all. And diabetes affects this part of the retina, and from here the signals are connected through your nerve of the eye onto the brain. So with affection of retina, this connection between the brain and the eye gets cut and you are not able to see at all. So as I said, this is the part of the retina which conducts the signals to the brain. So we cannot see even if your lens is good, if this part is affected. Externally, the eye may look normal. So anybody would say, I don't have an eye problem. Why should I go to the doctor? Externally, the eye may look normal, but these tiny blood vessels which are there in the retina, they get affected by diabetes. You know, diabetes can affect the heart, it can affect the kidney. How does it affect the heart and the kidney and the brain is because the blood supply to these organs is affected. Same way in the eye also, these blood supply to the retina gets affected, and then you can have bleeding in the eye or other problems in the eye. So who can develop this? Anybody who has diabetes. It does not mean that if you have just now been diagnosed to have diabetes, you cannot have. You can have, though if you are having diabetes for a long time, some people will say that they have diabetes for 10 years or they have diabetes for 15 years, but they've never had an eye checkup done. That is not how it should be done. You have to keep control, but even if it is under control and you have a long duration, that itself is a risk factor. High blood pressure associated with high blood sugar, high cholesterol levels with blood sugar, pregnancy or smoking, all these are risk factors which can cause diabetic retinopathy in any patient who has diabetes. As I said, early stages, when you are in the early stages, you may not even know that your diabetes has affected your retina. So what is important is that once you are diagnosed to have diabetes, you must have an eye checkup at least once in a year in the early stages when you have no symptoms also. Later on, once the problem progresses, you may see some blurry vision or frequent change in your glasses, that your glass number keeps changing because now the retina is becoming swollen. Then you may see that some area on the retina, on the vision, you can see straight, but you can't see on the left or you can't see on the right. Poor color vision or difficulty in night vision or flashes of light. These may be some early symptoms which may be present. Or the vision is something like this, that you can see bits and parts which are okay, but these scotomas or these dark shadows keep on coming in your vision. This is time to have a checkup done with your eye doctor. So I will go through the classification just to tell you that you can have a simple background retinopathy, which means it does not need treatment, or you could be on the other extreme. That means you can lose your vision within days. So this is how your retina will look if you don't have too many problems, just small reddish spots which are there, suggestive of some hemorrhages coming up. So this is a photograph which can be taken by the eye doctor these days very easily. Most of the centers will have it. And this can help you see for yourself also whether you have diabetes or not. And then if you have, the doctor says that you have only small changes which don't need treatment, he will tell you that maybe once in 6 months or 1 year you come, but keep your diabetes under control. If you're not able to keep diabetes under control, this may worsen even faster. This is the next stage. Now you can see the blood is increasing in the retina. The blood supply gets compromised. There are areas of retina now which are not getting enough blood supply. And you can understand, if some part of your body is not getting blood supply, how will it function? So here again, you are going to have a checkup at least once in 4 months or so, even if treatment is not necessary. This stage, once the proliferation starts, once new blood vessels start, then your symptoms will also come. You don't have to wait for this. Even before, we can do some preventive treatment. So please have an eye checkup done. But once this starts, definitely treatment, lasers, injections, all that will be required. In some cases, so much bleeding can happen inside the eye that you lose all vision, then complicated surgery will be required. So it is a typical example of nip the evil in the bud. So diabetic retinopathy, before it causes vision loss, before it reaches this stage, when it is threatening your vision, the sight-threatening diabetic retinopathy, before that happens, please have a checkup done with your eye specialist. Just like you have diabetes and you go to your physician every 3 months, you must go and meet your doctor, eye doctor also as regularly. It is as simple as that. So this is the stage when you will need complicated surgeries, and before this happens, we need to control it, and that can be taken care of. So once you have this bleeding in the eye, retinal detachment, high eye pressure, all that has to be addressed only by a very complicated surgery, which itself can be done by a trained vitreoretina surgeon, and then there's always risk of vision loss. And even after surgery, complete visual recovery may not happen. So there is risk of blindness. So there is another thing called diabetic macular edema. What happens is we know that bleeding can happen. Now we understand that because these blood vessels which form on the retina, they are leaky, they are abnormal, they leak blood. But what is this? Because of the swelling, because of the faulty blood supply to the retina, the central area of the retina called the macula, which is responsible for good vision, that now becomes leaky. So it swells up. And because that is responsible for sharp vision, because if that area swells up, your vision becomes very less. So in that situation, even before risk of bleeding happens, the swelling of retina also is another cause by which you can lose vision. So you can lose vision in diabetic retinopathy by bleeding in the eye or by swelling of the retina. For bleeding in the eye, you need laser treatment and surgery. For swelling in the eye, you will need this kind of a test which shows you that this retina is swollen up. Normally, it is very nice and compact. You can see if you don't treat, this swelling goes on increasing, and then finally the cells of the retina weaken, and then they lose vision if they are not treated on time. So to diagnose your retinopathy, when you go to a doctor, the doctor will put some drops in your eyes to dilate your pupil or widen your pupil so that he can see. And then he uses this special instrument called indirect ophthalmoscope to see with this lens inside the eye. Normally, we cannot see the retina until unless you do this kind of a test. Or they will do a scanning like optical coherence tomography. This is now becoming very frequent because it helps the doctor to not only see the swelling but measure it also. So if they give you some treatment to see whether the treatment is working or it is not working, they will do this scan repeatedly and tell you that this is working, not working, we need to give more injection or we need to do more treatment. Another test which can sometimes be required is fluorescein angiogram, that they will inject some dye in the vein and of your blood vessel in the hand and then take some pictures of the eye. It is also usually very safe test unless very few people may have some allergy to it and then they may develop some problem, but usually very safe. But even then, to prevent this test also, now we have newer tests available which can give you a similar picture of blood supply of the retina without giving this dye injection as well. So it is 100% safe. All these tests can be done very safely and in almost all institutions and centers of Agarwal Eye Hospitals. And here you can see that what are the treatment once they decide that diabetic retinopathy is there. How do you treat? You have to do laser treatment or sometimes injection in the eye will be required. And in worse scenarios, when there is already too much of blood or retina is getting detached, you will need surgery. So this is what laser does. These blood vessels you can see which are leaky. These are abnormal blood vessels. Normal blood vessels are these. They don't leak. They don't give blood in the eye. But when abnormal vessels grow because of diabetic retinopathy, they give blood in the eye. I'm sorry if this is looking a little scary, but the idea is to show you that when this blood comes, the light cannot reach the retina. If the light cannot reach the retina, it will not reach the brain. So then obviously your vision becomes very, very bad. With laser treatment, this is how laser is done. Lot of times the blood gets okay, but if it does not resolve, it does not go, then we need surgery. Injections are required, especially when you have diabetic macular edema. This swelling does not respond very well to injection, laser or surgery. The only treatment or the best treatment is injection in the eye. Unfortunately, these injections have to be given frequently. Almost every month you may need these injections till the swelling comes down. So this is the best treatment as of now. A lot of research is happening if we can have some drops instead of injections. But till date, this is the best treatment. This is done to safeguard your eye from going blind, and because diabetic macular edema responds best to these injections. Frequent follow-up almost every monthly with scanning of the eye may be required once you are taking these injections, and these are various injections which the doctor can offer you, and he can explain to you which is the best one in your case scenario. Surgery when retinal detachment, better is not to reach this stage, and best is to do prevention and take care of your eyes and your blood sugars before that final stage of surgery. Because once you have it, does it really go away? Good control of blood sugar still can help at this stage to prevent further issues, but it usually does not reverse. So please, early stages, nip the evil in the bud. That is the key factor here. So to prevent loss of vision from diabetic retinopathy, keep your blood sugars under control. Talk to your primary doctor how better you can do it if it is not under control. Keep your blood pressure under control. Blood sugar, the best way to measure blood sugar is not your only fasting and random blood sugar. You should do that 3-month blood sugar, the HB1AC test. That shows you that how your blood sugar has been behaving in the last 3 months, because that a prolonged follow-up or a prolonged control of sugar is what is going to help your diabetic retinopathy. Not eating in the night before and having a good fasting blood sugar the next day will not work. Your 3-monthly test will show you that your average blood sugars have been under good control, which is what is finally going to be useful. Good control of blood pressure. If you have your high cholesterol along with high blood sugar, this multiplies the problem. So we must keep that under control. Lifestyle changes, regular exercise. We have seen people reverse their diabetes and blood sugar problems with regular exercise and lifestyle changes. So this is very, very important. From the eye point of view, don't wait for the symptoms to happen. Have a regular check. If you are diabetes, once in 6 months, you must have your eye checkup done. If you have started having symptoms already or your problem has already started, it can be as early as once in 3 months, and then follow your doctor's advice. I think I'm ready for any more questions which you may have, and we can make this session more interactive now. I can probably stop sharing.
So chat box is open. If anybody would like to ask any question to ma'am, we are open to it, please. So ma'am has already very beautifully explained and given us very deep insights about the diabetic retinopathy, how it's affecting the retina, how diabetes control has to be there, what all stages are to be there, how we have to control diabetes so that our vision is not affected. And most of the things have been very beautifully and very well articulated by the ma'am.
So usually what most of my patients ask me is that first question is that I am not having any eye problem, but how is that my vision is not okay? So this is what I say, that externally from outside, I often tell them कि बाहर से आंख ठीक लगता है पर पीछे के पर्दे में problem हो सकता है. So the retina may get affected, number one. Number two, they will ask that if I change my glasses, then will it become okay? So this is again what I say, that a retina is like the film of the camera. If your film is not okay of the camera, then whatever lens you put in front, it is not going to work. So you have to have the retina has to be okay. Then a lot of people will say, but I got my cataract operation done. Now how I will have a problem? So again, the same thing, that cataract is to do with the lens of the eye. So that you may have undergone that surgery. It is different, and this retina problem is different.
Ma'am, another one question is that is there a specific age in which people are affected by diabetic retinopathy?
So that is most important. You know, diabetes itself comes around 40, 50 age, especially the type 2 diabetes, right? And that is the working population, what we call. Imagine this is the population which gets affected by diabetic retinopathy. Cataract will still affect older people. Diabetic retinopathy is affecting the working population, and if you have a person who becomes blind or loses his vision in the working age, it is very, very sad. So this is the age highest incidence is 40 plus. Then you start having, the moment you are diagnosed to have diabetes, I think best is to have a first examination, you have it done then, because there are a lot of studies which have been done which have shown that 10% of the people who had diabetic retinopathy did not even know that they have diabetes. So we have this problem in India of undiagnosed diabetes also.
Right, ma'am. Right. Ma'am, another question which has come up to us is that if I have diabetic retinopathy, will it affect my children as well?
So diabetes can be hereditary. Diabetes itself can be hereditary. We have seen that if there are these are kind of diseases which are lifestyle diseases, but not everybody has it. So there is a genetic predisposition. So if diabetes can be hereditary, so can diabetic retinopathy. So you must have, if your family somebody has it, make sure you keep your checks on.
Okay, ma'am, thank you. Another question which has come to us is if diabetes are under control, but the vessels are still leaking, what should I do?
Yes. So what is important? This is a question again my patients ask me often. What is important is you come to the doctor after 10, 15 years of being diabetic. Now the macular edema has started, vessels are leaking, and you have now started controlling your blood sugars. Last 1 week, your blood sugars have been under control. But the leaking is because last 10 years it was not under control. So if the problem has already happened because of a poor control for last 10 years, just keeping sugars under control for 1 week will not work. Now we have to work hard to reverse the damage which is done for last 10 years. So continue the good control of diabetes as well as take treatment. So now both the things will be required.
Thank you, ma'am. Another question which has come to us is I am diabetic. My vision has changed recently. The far vision has improved, but my near vision has increased. Is it due to diabetes?
So sometimes diabetes, as I said, can cause frequent change in your glass number. That can happen. And that is because diabetes produces, in patients who are diabetic, they produces a substance called sorbitol, and that accumulates in your lens of the eye. So that gets swollen, and that causes a change in glass number. So sometimes it can happen. But what particularly being asked that your far vision is okay, near vision is changing, that may be just age related also. Because once we all cross the age of 40, our far or distant vision is okay with glasses, but we all need additional glass number for the near vision. So that may not always be due to diabetes process, but that can be checked. So it will still need best to have a checkup, and then you take your required class number.
Right. So ma'am, another question that has come to us is that my BP is normal, my age is 58 plus, my diabetes is under control, but still, can I develop diabetic retinopathy?
So important is also the duration of disease. So if throughout the time that you were having diabetes, your blood sugars were okay, your good control was there, then the chances of having diabetic retinopathy reduces. But the duration of diabetes itself is a huge risk factor. So once you have it for 5 years or 10 years, a yearly checkup or 6-monthly checkup, even if your other parameters are under control, is still important.
Right, ma'am. Ma'am, another question has come to our chat box. If I'm taking treatment of diabetic retinopathy, does it still affect my day-to-day activities?
So diabetic retinopathy treatment is in form of lasers or in form of injections. You can always do the laser, get the laser done. You don't have to be bedridden or anything and go back to your work the next day. If you have injection done, you just have, the doctor will prescribe you drops for 3 or 4 days and may ask you for a follow-up. And after which you can definitely go back to your normal work. It is not hampering your normal work. Yes, it does that you have to take out time to come for monthly checkups and injections as and when required. But otherwise, it is not that you have to be on bed rest or anything. Once you undergo the stage of surgery, then couple of days, 3 days, 4 days, 5 days, or 2-3 weeks rest will be necessary.
Done, ma'am. Ma'am, another question which has come to us is that I'm affected from type 2 diabetes mellitus. What is the range for which started ocular diabetic changes?
Yes.
When does ocular changes actually basically start?
Yes. So that is when you have type 1 diabetes, they say that it starts very young. So you should have your first eye checkup after about 4 to 5 years. But when you have type 2 diabetes, then you must start your eye checkup. First checkup should be done almost simultaneously. When you are diagnosed, you should have your first checkup done, because you may be that you were having diabetes earlier and you didn't know. So
Right.
first checkup you should do, a baseline checkup should be done. Later on, depending upon what stage you are, the doctor will recommend whether once in 6 months or once in a year or once in 3 months, what is it that is right for you.
Okay. So I think ma'am has very beautifully explained all the links that are with diabetic retinopathy, how it is affecting as per age, as per the sugar range, as per the other lifestyle changes which has occurring. So a very interesting question which has just come to us from another listener is, my husband is suffering from eye floaters. It may increase day by day. What is the treatment for that? He's not having diabetes. He's not diabetic patient.
Yes, so floaters, that is why the symptom is not very specific. Floaters you can have because of other retinal problems as well. Sometimes you have a jelly in the eye which shrinks, which happens around 40 to 50 years of age, and that may cause a floater. At that time also, you must get an eye checkup done, because sometimes a tear in the retina can happen and that can cause bleeding. So the eye checkup should be done. If there is no tear, if there is no new blood vessel, if there is no diabetic retinopathy, the doctor will tell you that you can wait and watch this floater. But suppose you don't get a checkup done and then you have a increased problem, then it is not good. At least whenever you start having a floater, have a checkup done that there is no problem because of any other issue on the retina. If there is no problem, then we can wait and watch, and slowly these floaters will go away. But a checkup for any floater can be there because of multiple reasons. A retinal detachment can cause floaters, tear in the retina can cause floaters, diabetic retinopathy can cause floaters, high blood pressure causing bleeding in the eye can happen. So it should not be ignored. Have a checkup done.
Another very beautiful request has come. If possible, please provide address of the doctor. So, sir, we are available at Sector 22 branch of Dr. Agarwal Eye Hospitals. And ma'am is available from 10 a.m. to 2 p.m. in the afternoon. And usually she starts her surgery around 2 p.m. and you can always contact us. We'll be giving you address for that also. You can write to us at patientcare@dragarwal.com for any more questions. So I'll repeat, you can write to us on the email patientcare, PATIENT, patientcare, CARE, @Dr. DRAGARWAL.com. So you can write to us there and we can share all the details with you.
I think there's
So-
one more question maybe, Harpreet. I think there is one, somebody's written, I am not diabetic, but on borderline, but suddenly have retinal detachment. So I picked up this question because I think it's very important. Diabetic patients can have other retinal problems also, in addition to diabetic retinopathy. So it's not that you can have rhegmatogenous. Retina can detach because there's a break, as I said, in the tear in the retina. So diabetic patients, when we take care, when we do surgery, they are more prone to develop infections. So we take care of those things when we do surgery for diabetic patients. But diabetic patients, just like any other normal patient, can have problems in the retina due to other causes as well, in addition to being prone to diabetic retinopathy.
Right. Ma'am, there's another question which says, on and off, when I bend down and I get up, I could see golden floaters. I'm 25 years old. And will that be any issue?
25-year-old, I think it's too early for you to have floaters unless you have high minus number. If you are a myopic, then you could have early floaters. So you must have a checkup done. This is a little early for you to have floaters. Other reasons, especially when you're saying when you bend down and get up, sometimes things like compromised blood supply or low hemoglobin, especially in young girls, that can also cause this kind of a sudden blurry vision when you move from sitting down to standing up position. Just have an eye checkup done. 25 years for floaters is probably a young age. Do consult your retina specialist.
Done, ma'am. So with this, we'll be closing this session and we'll be taking all the queries and all the questions at patientcare@dragarwal.com. I'm really very glad, and we all are very glad that you have been here participating and asked such a beautiful questions. Thank you, ma'am, for such an insightful session about the diabetes and very beautifully explained about the diabetic retinopathy, how it is affecting us and how it is causing vision loss and all those if not treated properly in time. And thank you to all the people who have joined us. Thank you to Team Agarwal's for arranging this webinar for all of us.
Thank you for all for being here, and I hope this really helps.
Thank you.